Hi, my name is Brad Herskowitz. I'm a neurologist, part of the Neurology group, or our larger organization called First Choice Neurology. I'm here today to talk about headaches. Headaches are one of the most common things that neurologists see as an outpatient. There are many different pain structures in the head and neck that can cause pain, and it's our job to determine, is this a serious cause for headache or not, and what type of headache is it, and how do we treat it? The structures in the head that can cause pain include the jaw, the ears, the eyes. The neck can cause pain as well. Different structures in the brain, like the meninges or the covering of the brain, or blood vessels or nerves can cause pain. So as you can see, there are many different causes for head pain or headaches. And again, it's our job to determine what the cause is. The first thought I have when somebody presents to me with a headache is this a serious cause? Is this something alarming that we need to be concerned about? Do we need to get imaging studies of the brain right away or send them to the emergency room? Things that would concern me, or symptoms that would concern me, would be new onset headache, an explosive or sudden onset type of headache, headache with a fever, headache with confusion or difficulty walking or things like that. Essentially, other symptoms besides a headache that would be alarming. Now, there are primary and secondary headache type disorders. Some secondary causes would be TMJ or jaw pain, caffeine withdrawal, ear pain, neck pain or cervicogenic headaches can refer pain to the head, sleep apnea, high blood pressure uncontrolled. So there are other secondary causes for headache that we need to address in our history and physical to determine how do we treat those to cure or prevent the headache. There are primary headache disorders as well. Those would include migraine, tension, and cluster would be the three most common types of headache disorders. Migraine headaches are generally throbbing, pounding, one-sided headaches, often fairly disabling. Essentially, you don't want to spend time with your kids, or you can't go to work because the headache bothers you. Usually, there's associated nausea and light and noise sensitivity. There are medications for that, so it's important to diagnose this primary headache disorder. Other types of primary headache disorders would be tension headaches, which is very common. It's sort of like a headband around the head, like a squeezing type pain, usually at the end of the day. And that can be treated with stress reduction or other types, potentially medications. Cluster headaches are another type of headache, which is usually in men behind one eye and kind of a stabbing pain. And that's also treatable. Headaches are very, very common. We see them very frequently. If you do have headaches, you should see your primary doctor or preferably a neurologist.